I just couldn't believe it that this chiropractor that no one really knows fixed this athlete in 2 or 3 sessions, and this big-time orthopedic doctor, he said there's no answers. I went, holy smokes, that's unbelievable how different these two experiences were and opinions on the same exact athlete. I want to figure out what really helps people. I want to figure out these concepts, these strategies, these ideas that actually help people.
Matthew Brackney is a nationally certified athletic trainer, certified chiropractic sports practitioner, and doctor of chiropractic. His master's in physical education and motor learning is from the University of Houston, and he has also served as an athletic trainer for Rice University. He currently owns Spine and Sports Therapy in Kingwood and is here today to discuss the often overlooked subjects of mobility and stability. In this discussion, we talk about how mobility and stability are different from flexibility and strength, as well as how to improve these aspects within your fitness journey. If you enjoy this episode, we would love to hear about it through a 5-star review or a quick comment on YouTube. Welcome to Only the Greatest Podcast. If you're feeling stuck and unsure what to do next in your fitness journey, we might be what you're looking for. My name is Philip. I own and operate OTG Fitness, which is a private personal training gym on the south side of Houston in Webster. I do this podcast every week with my best friend, Daryl. We've been friends since 3rd grade and working out together ever since. Also joining us today will be Sean. He's the one that makes this podcast not only sound great, but look good as well. Our goal here is to help Houston make its way up the ladder of health and fitness. So if you're in the Houston area and ready to become the greatest version of yourself, be sure to like and subscribe on your favorite podcast platform. Dr. B, man, long time coming. He finally made it.
Yes.
Welcome.
Thank you.
Yeah,
Thank you
man.
for having me.
We're glad to have you. You may have heard this in the podcast that we did with Dr. Chavez, and I don't know if I ever told you this, but I always introduce you as the guy that knows more about the human body than anyone I've ever met.
Yeah, wow.
And that's just how, I don't know how that came to be, but it is true. I'm not lying. I don't know if I've ever told you that.
No, you haven't. I was really flattered. I listened to the podcast and I was like, whoa, holy smokes.
Yeah.
I was very flattered.
And
thank you for that.
Yeah, because we've just talked so much we've known each other maybe a couple of years now.
Yeah, at least 4.
Oh, wow. Okay.
Yeah.
That long.
2019, I think.
Okay. And I've just had some of the best deep conversations about injuries, injury prevention, and things like that with you. And I've learned a lot. You were the first person to teach me that just because something hurts, it's not necessarily in that area. You call it your victim and culprit situation. So can you just maybe describe that real quick? And then we're going to start getting into this mobility and stability thing.
Yeah. And so just because you have pain in a particular part of your body doesn't mean that's where the problem is. So many times, the area that hurts is the victim. I call it the victim. It's the tissue, whether it's a ligament or muscle or tendon, that's getting twisted or compressed or strained, and it's starting to talk to you. It's telling you it's hurting. But that's not the problem. That's being caused by neighboring muscles or neighboring joint, some other type of mechanical dysfunction, alignment issue maybe, or muscle imbalance type issue. And those are the things that we need to be looking for. So if you figure those things out, you address that actual culprit, the victim will heal on its own. So,
yeah. And as a personal trainer, I know that. I know that's the case. If somebody tells me their knee hurts, well, maybe it's your knee, but maybe it's something else. But something about the way that you describe it and maybe the way that you talk about mobility and stability is probably a big part of it. Just really helped it click into my mind the victim versus the culprit situation, And so as we kind of get started here, and before we talk about exactly what mobility and stability is, and you're going to give us hopefully like a nice exact definition, and we'll talk about that. But you do seem to be very passionate about this subject. Yeah. And I remember that from when we first met. So kind of, I don't know if I've ever heard the story directly. Why don't you just kind of tell us, why is this like your main thing? Like what happened? How did you get into this? And you picked these two things, mobility, stability, that you seem to really talk about a lot. So maybe how did that get started?
Yeah, for sure. Thank you. I just have to also say your podcast studio is awesome.
Well, thank you.
It is righteous.
Oh, thanks, man. Yeah, we've put a lot into this thing. It's had a lot of iterations, a lot of variants. It's even been in, this is location number 3.
Oh, wow. Okay.
And variation number like 97. And we're only on episode 102. Like, so yeah, it's been a lot. But yeah, thank you. Appreciate that.
Yeah, so I think this started, I've been in sports medicine for a while. I was first an athletic trainer. So I worked at the Division I level for a few years, working with sports teams at a Division I university, and loved it. It was awesome. It was amazing. But one of the things there was a couple experiences there when I was working at that level that really opened my eyes to how things are done, and maybe if there might be better ways to do things. So there's a mainstream way of addressing injuries, medicine in general, right? There's a certain mainstream, and it's not always the best. So my specialties, sports medicine, orthopedics, that kind of thing. So I was there. Long story short, I remember I had a swimmer. There's a swimming athlete, and she started having upper back pain. She was dealing with it for a while. I was doing some treatments with her. It was sort of, getting a little bit better, but not really. It was still there. She was trying to compete through the pain, but it was tough. So we had her see one of the orthopedic doctors that are with the hospital system that was connected with that university. And that individual comes in, and they're a great doctor, a great physician, awesome what they did. But when it came to this particular chronic, repetitive type injury, back injury, he evaluated her, and then he told her, you know what, there's just nothing that can be done for this. You're just going to have this forever, and you're going to have to deal with it. And that was really abrasive, even to me. I wasn't even the athlete, right? But so to this athlete, that was really jarring to her, and she thought, well, crap, am I going to lose my scholarship? Am I going to be able to not compete and swim anymore? Am I not going to be able to finish my degree? These are the things college athletes think about, because a lot of the times their education is tied to their athletic endeavor. So anyway, it was just really shocking, but we didn't give up. We actually had her go see my mentors, who are sports chiropractors. I was just an athletic trainer at the time, and he saw her 2 or 3 times, and she was completely fixed. No more pain. It was completely gone.
In 3 sessions, I guess you would call them.
Those guys, they would come a couple times a week and work on the athletes. Like I said, I was an athletic trainer, so athletic trainers kind of oversee entire teams' sports care. So we do the rehab with the athletes, but there are times when we outsource to specialists to help with different things. So I just couldn't believe it that this chiropractor that nobody, no one really knows, and I fixed this athlete in 2 or 3 sessions. And this, with all due respect, she saw this big time orthopedic doctor, and he said there's no answers. So I went, holy smokes, that's unbelievable how different these 2 experiences were and opinions on the same exact athlete. So that's really what got me interested in, I want to figure out what really helps people. I want to figure out these concepts, these strategies, these ideas that actually help people.
Yeah, and I want to backtrack just to touch on something that you said about it was kind of abrasive to you. Could you imagine what it felt like to the athlete? Mm-hmm. And I don't really consider myself an athlete, but I do love to exercise. Exercise is what I do for a living. And the unforeseen consequences of injuries are very high. And I could imagine, and you just broke it down from a college athlete's perspective, even me, if I get myself hurt, dude, everything's going downhill. From my work ethic, my work life, my relationship may suffer, because I'm
cranky,
upset. Cranky's a good word. Yeah. I'm, just mad that 100%. I'm not, focusing on my athletic endeavor at the time. And I'm not even an athlete. My scholarship's not on the line, but I feel like my life's on the line.
Yeah.
I hurt my back, and I can't run. I can't exercise.
Yep.
I'm not moving that well. Dude, my life is on the line.
Yep.
It is very deep. So I can completely understand why that would upset you and anyone in a situation like that.
Yeah, for sure.
And
Movement is essential to life. If we can't move, our life significantly becomes, degraded quickly.
Sure.
So it's so important to be able to move, exercise.
Yeah,
sure.
and that being said, why don't we just go ahead and start talking about, the two big things, which are mobility, stability. And we'll start with mobility. We'll move into stability. Let's talk about what exactly mobility is. So is there an exact definition for that, or how do you think about mobility?
Yeah, it's defined a little bit differently in different circles. But that experience that I just described, like I said, kind of put me on this path to learn what are the things that can help people the most. So I kind of went down that path. And the way mobility and stability came up is, and I'll get into this in a little bit, but these are two of the most important things that if people learned, they could dramatically reduce their risk of injury. They could reduce the severity if they do encounter an injury. These were just some of the most impactful things that if I taught people these strategies and they learned them, it dramatically reduced their injury load or risk of injury.
Yeah, and something I definitely want to touch on before the end of this is why people don't think that or they don't know about it.
Yep.
Right. So that's something that we'll definitely touch on as we kind of move through these things.
Yep. So I use the term mobility instead of flexibility for a couple different reasons. The term mobility, like I said, there's sort of there's a few different definitions based on what area of medicine you're in. Like, for example, if you're in geriatrics, home health, they talk about mobility as just, can you stand up? Can you sit to stand? Can you walk? So it just more in the general term of the word, is this person able to move physically, but the sports medicine definition that I typically use, it relates to not just muscle flexibility, but also joint motion. Is the joint able to go through an entire range of motion, or is the joint getting stuck at a certain range of motion? So instead of flexibility, that term typically connotates just muscles. It's talking about just muscles and how elastic and stretchy a muscle is. And that, to me, goes into mobility. It's a factor, but so are the joints. And do the joints have an appropriate range of motion as well?
So you can be flexible, but not mobile.
Yes.
But you can't be mobile and inflexible. Is that the word?
Yes.
Am I saying that right?
Yes.
Yeah. So mobility is the combination of both.
Yep.
Right. So maybe if you could describe what would be wrong in a situation when someone has muscle flexibility, but they don't have joint mobility. Like, what's going on in a situation like that, and maybe what would cause that?
Yeah, it's a great question. So what I've learned over the years and what's helped me be able to, apply the right treatments to the right person is understanding their body types. And what I mean by that is different people have different body types. Some people are naturally tight. Their muscles are naturally tight. Their joints are naturally tight. They're just tight.
This guy. Yeah.
So those people need to stretch and roll and use vibration guns all the time, just nonstop. Then there's another side of the opposite side of the spectrum is people that are naturally loosey-goosey. Their muscles are loosey-goosey. Their joints are loosey-goosey. Think about people that maybe consider themselves double-jointed. They don't need as much of that stretching and mobility work. They need more stability work. We'll kind of get into some of that in a bit. But to answer your question, those people wouldn't need to stretch as much because their muscles are naturally kind of elastic and loose. But what happens is when muscles are too loose, one of the main jobs of muscles is to keep joints stable and happy. So if muscles are too loosey-goosey, then the joints get overly tight and restrictive and compressed, because the muscles aren't contributing as much to the stability of the joint. So that's a great example where someone could have tight movement, tight joints, but really flexible muscles.
And what would happen in a situation like this? Are they more prone to injury? Are they going to experience certain pains? Are they unable to do certain things?
Yeah, it definitely predisposes them to excessive stress and strain, particularly in their joints, and then injury for sure.
Yeah, and you see this a lot in all joints, whether it's knees, elbows, shoulders, or anywhere in particular.
It can totally be in all joints. You typically see issues in a lot of the bigger weight-bearing joints like knees, hips, low back, unless they were like a tennis player, for example, and they were always swinging with their right arm. Then their arm and shoulder might be more susceptible to something like that. Mm-hmm. So if they use a particular body area more in their activity or sport, then that could predispose that particular area. But typically, those people tend to have a lot of back issues because the back is supporting them, right? And because the muscles are so flexible and loosey-goosey, there's just excessive movement into the back, and that can lead to excessive stress and strain and then injury.
Yeah, so if someone is an athlete and they're using a particular body part more than another, that's maybe where you see this situation come into play with possibilities of injuries in that area. Totally. And then it's almost always related to the back. And as a trainer, someone that's constantly working with people on exercise, the low back always seems to be a problem. So can we maybe, since we're on that topic, I'm imagining maybe people listening to this, the low back is an issue with maybe a good percentage of them.
Super common.
Yeah. Can we talk about maybe, is there a mobility issue that seems to be consistent with low back problems?
100%. And it's different than what most people think it is.
Okay. Victim and culprit.
Yep, yeah, totally. So most people, when they have back pain, even tightness maybe in their back, they think, let me stretch my back. And that's not the best initial route to pursue. There are some times where you need to stretch your back, of course. But most often, part of what leads to some of these low back issues are tightness in your hips. So tightness in the glutes, the glute max, the glute medius, the hip flexor muscle, the iliopsoas. These are the particular areas that when they get tight, they begin to influence the back. They begin to pull it and shift it in different ways. And that's oftentimes a big factor that leads to a variety of low back injuries.
And that could be a flexibility or mobility issue. Is that right?
Totally. And sometimes it's a little bit of both. So tightness in the hip flexors is super common. Lots of us sit throughout our days, whether we're at school or at work, and in that seated position, that hip flexor muscle is shortened, and then it kind of adapts and tightens to that shortened position. And if you look at where this muscle attaches, it makes so much sense. It's called the hip flexor, but it's sort of a misleading name. It's a really big back muscle. So if you look at this anatomy of this particular muscle, Google iliopsoas, it's a massive back muscle. It anchors and attaches to the entire, each of the lumbar vertebrae, the low back vertebrae. So it goes almost to the bottom of the rib cage, and then it comes down into the hip. So when it's tight, you look at this muscle and go, oh, yeah, of course that makes sense. My back hurts when this muscle's tight. Mm-hmm. Yeah.
We're going to get into some exact steps that we can take. Like if anyone listening to this is experiencing this issues, we're going to talk about different ways that we can foam roll, stretch, and address all of these issues with mobility. Mm-hmm. But before we do that, I want to touch on stability as well. Yep. So can we talk about, I have a couple of questions specifically, but I'll just let you go ahead and define what stability is first, and then I'll follow up from there.
Yeah, for sure. This is another one of those really important concepts. Stability, it sounds like it's the same as strength, but it's not. Strength is being able to move something across a distance, being able to move a barbell or a dumbbell across this distance. That's what strength is loosely defined as. Stability is the ability to limit unwanted motion in a particular body area. So what you're trying to do is prevent unwanted motion in an area. So let's take the low back, for example. If there's instability in the low back, then the low back is going to shift around, move around, and that's going to cause stress and strain to a variety of tissues in and around the low back. The muscles, the tendons, the ligaments, the discs. So when there's too much movement in the low back, that's oftentimes what leads to the issue. So stability, if you were to stabilize your back, you're locking it in place and preventing that excessive unwanted motion. So
can you be strong and unstable?
Yes, 100%. It's really common, actually. So there's lots of people, even people that come to see me, that are very strong individuals. They can move weight. They move a lot of weight, but they don't have the appropriate stability to protect themselves, to protect their body. Now, naturally, over time, even if you're strength training and not stabilizing yourself well, you're going to get residual improvements in stability just by naturally strengthening your body. But what I like to do is try to help people have an advanced ability to stabilize themselves so that, one, they're more protected from injury, and then two, it actually optimizes your performance. You know, it makes you stronger.
So you can be strong while being unstable.
Yes.
But you won't be as strong as you possibly could be.
Yes.
Is that correct?
Yep.
Yeah, so you're not optimizing if you're missing the stability piece and you want to be as strong as possible, you could be missing out if you're not focusing on stability.
And also setting yourself up for injury.
Yes. And on that note, I wanted to ask, you mentioned that with mobility, a lot, it's like, I don't want to say that it's genetic. Is it genetic and in the way, like genetics play a role in how tall you are, right? Are genetics also playing that role in how loose the muscles are? Is that kind of what you were saying earlier?
It's definitely a component, 100%. Yep. There are even some genetic conditions that, Ehlers-Danlos syndrome, for example, is a genetic condition that causes excessive laxity in ligaments and connective tissue. So it's 100%, that's a factor. I think also a factor is, if twins, for example, were born identical twins and one of them went into gymnastics and the other one went into powerlifting, one of them would probably be more flexible than the other one. So there is a strong component to the activities that you do, but I think there's absolutely a large connection with some people are just born different.
In this case, it's nature and nurture. Right?
Yes.
Let's just, I saw
exactly.
I did see, it wasn't this, but I did see a study one time. It was two identical twins. They were males, and when the study was performed, they were both, I think, in their 50s. One of them they were identical twins, everything identical. One of them was a regular exerciser for their entire life, and the other was not. They were both same body weight, even in their 50s. One exercised their whole life, one didn't. Same body weight, but the tests, night and day, because one exercised and one didn't. So for sure, there is a nature component, but there's also a nurture component going on here as well. But to kind of get back on track here with stability.
Yes.
And if we want to be as strong as we possibly can, what happens if someone is missing these components of mobility, stability, and they're hitting themselves hard and that they're kind of, slowly but surely going on and they're ignoring it? Can this be fixed, or is it something that they're just going to live with because of this genetic component?
No, 100%. It's definitely something that can be addressed and fixed. And kind of like I was alluding to before, different people's body types means they need more of one versus the other. Someone that's more loose and excessively flexible needs more stability than mobility. And then on the other side of the spectrum, individuals that are excessively tight and compressed, they need more mobility than stability. So it needs to be individualized for each person. But absolutely, that's why I've this has become something I've championed, is because these are the things that can help people make a difference in their own body in preventing injury, fixing injuries, staying active.
Yeah, and someone should be doing this, because the example that I just made was someone that's kind of feeling a little ache and pain, so that maybe they should step away from the heavy weights or whatever activity and maybe focus on this. How long? How long should they be kind of focused on this before they get back to their regular activity? Or does it just depend?
Yeah, I mean, it definitely depends on the severity of their pain, and how much or often they engage in these particular activities. But this is something that I think of, like, since you were a little kid, our parents taught us, what do we do before we go to bed? We brush our teeth, right? We brush our teeth, we floss, maybe use mouthwash, perhaps. We've been doing those things since we were little. I have little kids. You know, I taught them since they were able to stand and walk. They brush their teeth at night. And we do that because it helps take care of our teeth. If we didn't brush and floss, we'd have to go to the dentist like every month.
Yeah.
But no one wants to do that, right? So you brush and floss every day. Well, doing these things is like brushing and flossing your muscles and joints. Doing mobility and stability is the brushing and flossing of taking care of your muscles, your joints, your back, your knees, your hips, your shoulders, your neck. So if people, why I brought that up is you mentioned, you know, how long should they do this before they can get back to their activity? I'd like them to do this forever. They should be doing this every day. You know, we should all be doing these things every day because these are the things that help keep our body healthy. I've had people ask me before, like, oh yeah, I stretched yesterday and it felt good, and then today it's tight again. I was like, and they were like, why didn't stretching work, or why didn't it work? I'm like, okay, yeah. Did you brush your teeth yesterday? Yes. Did you brush your teeth today? Yeah. Well, how come it didn't work? How come brushing your teeth didn't work yesterday? It did work, but you ate again. You know, so stretching works, but then you get tight again, and you have to. It's maintenance.
Yeah. What a great example.
Yeah.
I'm sure you've told that story many times.
Yeah, for sure.
Because
so many people say stuff like, "Oh, stretching doesn't work," or
foam
rolling
rolling
doesn't work.
Yeah. I have to admit, very much been a victim of that. Don't tell anybody though. Yeah, I mean that's a really great example. So you're talking about it from a preventative and maintenance perspective, right?
That for sure, 100%. But yes, you're absolutely right. If someone is dealing with an issue, an acute event, a new kind of injury or pain issue, then you'll do these activities in a concentrated dose to help get back to where you're.
So what you're saying is you should be doing mobility and stability. And here in just a second, we'll talk about some exact things for each one. But what you're saying is you should be doing both all the time. And then maybe if you're experiencing a particular ache, pain issue, something feels off, then maybe you just modify, say, and what kind of time are we talking about? If you say, say you prescribed me to do this. I work out 5 days a week now, or let's say I work out 4 days a week.
Yep.
And that being said, 4 days a week, I lift weights, I run a couple times a week. Kind of typical person, try to be active. I'm not a super athlete, but I care about my health. How much time are we talking about?
So I recommend people do smaller doses more frequently. So instead of doing this twice a week for 4 hours, I recommend people do stuff like this in general, daily, every day, but for a small amount of time. So 2 minutes of stretching and rolling, 2 minutes of a couple of these little stability, little exercises. And if you did that daily, that would be better for you than doing 2 days a week for 2 hours each time, you know.
So let's say I did 5 minutes a day.
Totally.
And so if I'm feeling a particular ache, pain issue, where I would usually try to do like my whole body, you know, during that time frame, maybe over a couple of days or whatever, I could just, you know, modify a little bit, target
the
that
particular area.
That particular area.
Yeah.
And if you're not, then for sure you should be doing these things on a daily basis.
Yeah.
Right.
Yep.
So let's talk about exactly what to do, and then also how do I know if I'm the person that should be doing more mobility and stability? I know we kind of talked about it earlier, but let's kind of get a little more specific here. How do I know that I'm the person that needs mobility work? And if I'm that person, what do I do?
Yep. So couple of the things to self-identify, let's use this example of someone that's excessively tight, is it's pretty easy, you know, do you feel excessively tight? So most people kind of know, they feel their own body, and they know after a while, just in general, they've bent over and touched their toes. They've seen other people be able to do it, and they can't do it. You know, so most people have a general understanding of whether they're tight or not. But but yeah, doing certain stretches and not having the full range of motion. So your heel should be able to touch your butt, right? When you do a quad stretch, you should be able to, I'm not a big fan of doing this for hamstring stretches, but bending over to touch the toes, you should be able to touch your toes. And if you can't, those are signs that there's tightness, at least in the thigh muscles. And then what was the second part of the question?
I was just saying, how do you determine if you're the person?
Yep.
Right. And now what do we do?
Yep. So there's a few main things that we want to address with excessive lack of mobility, tightness. There's a stretching component. There's a massage component, I'll just say. People have seen foam rollers, handheld stick rollers, lacrosse balls, now vibration guns. You see all these things. Oh my gosh, where the heck do I start? What do I do? Those things are all do the same exact thing. It's all underneath the same category: foam rollers, stick rollers, lacrosse balls, vibration gun. They're useful in different body areas and for sometimes different, if you have, different types of injuries. Kind of like a Phillips head screwdriver and a flathead screwdriver. They're both screwdrivers, but you use them sort of for different jobs. Mm-hmm. So all of those I lump into they're in the same category. But doing stretching plus that self-massage stuff, whether it's a foam roller or a vibration gun, is really important because those two things do different things. So stretching and rolling, it's like, I'm going to go back to the teeth. You need to get a dentist on the podcast next.
Yeah, I guess so.
Go back to the teeth analogy. Brushing and flossing, they're both for teeth health, but they do different things, right? Mm-hmm. So in the same way, stretching and then the massage stuff, vibration gun, foam roller, they're both for muscle and joint health, but they do different things. So the massage is more for the connective tissue, the fascia. So when fascia gets excessively tight, excessively adhesive, fascia is the connective tissue that it surrounds muscles. It goes through muscles. It connects muscles to bones at times. It's a supportive connective tissue throughout the entire body. It even goes through and supports our internal organs. Our internal organs are covered by different layers of fascia. Anyway, that tissue is normal and good, but there are times when it becomes excessively dehydrated and sticky and tight, and that limits function. So doing the massage work, the foam rolling, the vibration guns helps to loosen that tissue up so that muscles can flex and activate appropriately without being restricted by these fascial adhesions. Stretching is more for two main things. Knots, when you have a knot in your muscle, stretching is effective for those knots. And also when a muscle has become adaptively shortened. So what I mean by that is, you ever talk on the phone for a long time and your bicep muscle starts to get really
I almost feel like it's going to cramp.
Yeah, and you got to stretch it.
Yeah.
Well, muscles adapt.
That's kind of dating us here. So you ever on the three-way on the party line, man? Just talking at 3 a.m.
It's been a while, but yeah.
That's funny. Ever get finger injuries from dialing?
Rotating.
That happens. The muscle is adapting to the position that it's placed in, and it's getting excessively tight. So that happens to any body area. If we're in a shortened position, like I talked about before with the hip flexor analogy and sitting, when you sit, that hip flexor is in just a shortened position, and when you're in that position for a long time, it tightens up. So that's the other area where stretching is really valuable for.
Nice.
Yeah.
And I had two follow-up questions with that. The first one is a little loaded, so I'll switch to the second one, which I think is maybe a little bit easier.
Okay.
The first one is, where does human massage fit in to that? Is that something that, if I'm doing this every day, I don't need human massage anymore? Is that still something people should consider? Because I hear a lot of people that are all about getting massage once a month, once every 2 weeks.
Yeah.
So where does a human massage fit into that?
Totally. Great question. It's back to the dentist analogy.
Okay.
We brush and floss every day, right,
Yeah.
to take care of our teeth. But every once in a while, you need a deep cleaning. So every once in a while, you need to go to the dentist, and they can do a deeper cleaning. They can get in deeper areas.
I
And
should have
that's-
been able to figure this one out myself.
Man,
I should have known.
You walked right into that.
Yeah,
one,
I
man.
did.
What's going
Yeah,
on?
yeah. You're welcome for the layup. You know, for that one. Then my other question is, you mentioned doing this for a short amount of time, like you said yourself 2 minutes a day. Man, I got a lot of muscles. You know, I got chest, I got back, I got biceps, triceps, calves, quads, glutes, hamstrings. You know, to stretch and foam roll, you know, takes some time.
Totally.
So how do I break this down to hit all the muscle groups that I need to do
Yep.
in a short amount of time?
Great question. So in the beginning, that sounds really daunting. That sounds like, oh my gosh, where do I start? How do I address my body? And this is where having a little bit of expert help can guide someone. So the more someone learns about their own body, the more they're going to be able to know exactly which areas to target. Because, I woke up and my neck's a little bit tight. If they know their body, they'll know exactly which areas to start working on and hitting. Not everybody knows that, though, at the beginning. So they need to learn it. So they either learn it through self-education and learning things about the body, or they get some expert help from a savvy clinician, like a sports physical therapist or sports chiropractor, and that individual can guide them and teach them. So like I mentioned before, the low back's a great example. So wake up and you have some low back tension tightness. Initially, you know, we think, oh, let me just stretch my back. But once someone learns that it's actually hip tightness that is the factor that leads to back issues, then they know they just need to target their hips, hip flexors, glutes, etc. So initially it seems daunting to think about how do I work on my entire body, but the more someone's able to educate themselves on how their body works and what are the victim culprit relationships, if they learn those things, then it becomes very simple and very easy to execute, to do on a regular basis.
Someone that I know, and you know as well, Dr. Frank.
Okay. Yep. Mm-hmm.
He taught me this. It's right along I didn't think of it until you started. He pretty much said the same thing you did, and we were talking about this one day. And what he told me is he has his list. He calls it just his little list. He knows what his long-term issues are, and if he feels good all around, he just goes ahead and hits those things anyways. If he's dealing with something specific, then that will take priority.
Yep.
But if not, he has his little list of a few things. He's like right hip, left quad.
Totally.
And so, you know, like you're just saying, once you learn your body, you know what those things are.
Yep.
Right. And for me, for example, right quad.
Yep.
Remember when I had that shin splint? Like I know that from talking to you and talking about it and stuff, we went through some different exercises and we talked about stuff to do. But my right quad, I noticed during that time, stay tight. If I get on a foam roller on my left quad, yeah, it's a little tight over. Get on that right side every time. It's, you know what I mean? It hurts. I feel it. So that's my little, you know, my day. If I'm feeling good, I feel like I don't need to do anything. I know I can get on that right quad on the foam roller,
and it
probably needs it.
Yep.
Yeah, for sure.
Yeah. So that's a great point. So just doing mobility routines and practicing is one of the ways that people can learn, because just like you just said, so they'll get on and they'll stretch their right glute and stretch their left glute. Holy smokes, my left glute is way tighter than my right glute. Now, so that's something that people can learn just by starting to do some of these things on a more regular basis.
And what causes that? Is there a genetic piece to that where or is it maybe their activity that they do?
It's usually more like postural or
Okay.
activity based. So this happens all the time, right? When we sit, we'll cross our right leg over our left, but not our left over our right. We do stuff like that all the time. I call it daily postural imbalances. So, but we do things like that when we're driving. We'll like put our elbow out the window or on the little middle console panel deal. We'll do these little postural imbalances all the time, and we don't even realize we're doing them. But those things can lead to,
You know, what just came to my mind is sleeping. When you sleep,
100%.
you have certain positions. People are side sleepers, back sleepers, stomach sleepers.
Yep.
Pillow, no pillow.
Yep. And think
different
about
things.
it. We're in that position for 6 to 8 hours. it's a long time to be in one particular position. You know, people move around and stuff like that. But yeah, sleep posture is huge for body posture and
Whatever you waking up
balances.
with out of balance because you were out of balance during that 8 hours that you were asleep.
Is there an ideal sleep posture that you would suggest?
Good question.
Yeah. So I typically recommend sleeping on your back. And mostly from the spine perspective, because there's other people like ENT, ear, nose, and throat doctors that'll say you shouldn't do that because it affects the ability of you breathe through your mouth more when you're on your back and not as much through your nose. So there's some other factors that I'm not a specialist in that might say differently. But in regards to the spine, I recommend people sleep on their back, but doing a pillow underneath the knees. So, you know, normally if your legs are just straight, your back arches a little bit, and that can be uncomfortable and that can lead to some back pressure. But putting a pillow underneath your knees then flattens that low back out and really helps mitigate stress and strain.
Speaking of sleep, we need to talk about this a little bit because I think it's really important. Something that you taught me, maybe I guess probably a few years ago, that Denver probably still hates you for is because I'm a side sleeper, but I put a pillow between my legs.
Yes. Yep.
And that helps. That helps me a lot. So can you talk about that?
Yeah. So side sleeping isn't terrible. Side sleeping is okay. I generally try to recommend people go away from stomach sleeping because it's just not ideal. You know, you have to crank your head to the side. Your one arm's underneath the pillow, up above your head. You know, one leg's up to the side. You know, it's just too many wacky, weird positions. But anyway, so sleeping on your side is okay, but with the caveat of putting something like a pillow between your knees. When we don't do that, that top leg tends to really flop over the bottom leg, and that causes a lot of rotation in our pelvis, hips, and low back. So that's a really common cause of people's back issues, and they may not even realize it. So yeah, sleeping on your back on your side is fine, but I recommend the pillow between the knees.
Yeah, and the reason I said that is because Denver always she hates that there's always a pillow like in the bed. You know what I mean? Like at all times, it like stays there in like a vertical position. You know, and it's just always, I guess, in her way or whatever.
I sleep with a pillow in between my legs too, dude. It's so comfortable.
Yeah, it's more comfortable, and then it also has this extra benefit as well. Yeah, of kind of keeping you in alignment and stuff. Totally. But let's switch a little bit to let's answer the same question.
Okay.
From a stability perspective, and remember I guess it was 2-part question. The first part, how do I know I'm the person that needs stability, and then if I am, what do I do?
Yeah. So like we were saying, everybody needs both of these, but to what degree they need it can be different. So individuals that need more stability would be people like I kind of mentioned before that recognize that they're maybe double jointed. So sometimes a quick test is like being able to, if someone can easily touch their thumb to their
forearm,
to their front part of their wrist, that's one of the orthopedic signs for excessive ligament laxity there. So that's a test. Also, when someone stands and they lock out their knees, if their knees go backwards.
Oh, I see that a lot.
Yeah, I've seen it before.
I wouldn't say a lot, but I'd say that's more common. I
totally.
think.
A lot of swimmers have that ability. It makes them better swimmers because they have more. They can kind of generate more force. So those are some common little things. But doing the thumb to the wrist thing is a common little self test that someone could do.
And most people know, like you mentioned earlier. Now that you say this, because you mentioned this earlier with the mobility thing. Now that you make this reference to just excessive motion of joints, people know that. Like I work with people all the time where they've never exercised before, and they're like, my arm goes backwards.
Right, that's another one.
Or
straighten out your elbow. Does it go?
Like we talk a lot about shoulder mobility in the gym because that seems to be a big issue with like upper back pain.
Totally.
And then just the ability to do a lot of weightlifting movements, like the shoulders are involved a lot. Yep. So people will often, like when we're doing shoulder mobility stuff, they're like, yeah, my shoulder always like moves around real easy. And I'm not saying everybody says this, but
it's common.
I've seen it, so that seems to be pretty easy to know that I'm the person that maybe is. So now what do I do though? What do I do if I'm not?
So the key here is then learning some of these different stability strategies. And there's really two main components that I think about when talking about stability. One is brain muscle connection. So can someone activate a particular muscle? In this case, a stability muscle that we're talking about. So that in general, this is very generic. There are two types of muscles in the body. There's stability muscles and movement muscles. So the movement muscles are like the biceps, for example. You know, it moves the range of moves the elbow, the shoulder as well. And then there's stabilizer muscles. These muscles inside the body contract to, like I mentioned before, reduce the excessive motion of a particular body area. So with that in mind, most people are able to activate and engage those movement muscles, but there's a surprisingly large amount of people that have a hard time telling their stability muscles to activate and turn on. So having that appropriate brain muscle connection is really important, and that's one of the factors that I try to help people with. The other one is finding the appropriate posture for that joint to be in. So if you're going to stabilize a joint, if you're going to activate your stabilizer muscles, you want the joints that it's stabilizing to be in a good position. You don't want to try to stabilize a joint if it's in a wacky position, right? You want to make sure the joint is in an appropriate alignment or good position.
Can you give us an example? I'm having a hard time with that one.
So the low back is a great example. So a lot of times when people stand, they have an excessive arch in their low back.
Okay.
Butt kind of sticks out, stomach kind of sticks out a little bit. I sometimes refer to it as like pregnant posture, because when women are pregnant, their belly is...
They're offsetting weight.
Forward, exactly. And their back is really hyper arched. So when that happens, there's excessive pressure, stress, and strain in the back. That's why a lot of pregnant women have back pain. But a lot of us that get into that posture, we don't even realize that we're into it. Also, that's a really common underlying factor for back pain as well. So it's not enough just to engage the core muscles, the glute muscles in that overarched position. You need to first correct that arched position and get a low back position so you're not arched. And then you stabilize activate the stabilizing muscles. So you want to get out of that excessively arched position and into a more neutral, aligned position. And then when you're in that position, then you can activate these core muscles and glute muscles to lock it in place in that good neutral position.
And in this case, are you talking about like a plank? Is that the example that you're making right now?
That's a great way to depict this. A lot of times when people do planks, you'll see a big sag in their low back. And when they do that, it's really counterproductive. Their core is not engaged because it's
falling.
It's falling. Yeah, exactly. And then there's tons of excessive pressure in the back. And so a lot of people say, oh yeah, I hate doing planks because it hurts my back. You should never feel your back doing a plank. That's not the area that you're supposed to feel at all. And they're not even feeling muscle fatigue. They're feeling just joint pressure. So that's a fantastic example. So how we fix that, and you know that, and most fitness experts know that, is that you just have to flatten the back. If you get your back in that flattened position, and then when you do that, you should be able to feel your core muscles and not back pressure. So yeah, that's a great way to describe it.
And since we're on this, I think this is a really important topic. So I just want to go a little bit deeper with the plank and low back thing, because everybody knows, even if you're getting started, low back pain, like everyone at this point has correlated that to core lack of strength.
Yep.
Right. Lack of stability in the core. Right. So most people, I feel like they've heard that before. My low back, I know I need to work. I hear this all the time in the gym. They're coming in, you have this low back pain. And they tell me I need to work on my core.
Yep.
Right.
Which is great. I'm so happy that that's at least permeated into our society, that most people realize and recognize that core strength is connected with protecting your back.
Yes. But something else I see, and I just want to hear your take on this, is some people can hold decent form on a plank. And then when they're done, they'll still say, I still feel my back. What's going on in that situation? They have good form. The form looks good, but they're still feeling that low back.
It's a great question. So that goes to that first concept that I talked about with stability, which was the brain-muscle connection. So people you can look from the outside and it's like, oh, form is perfect. But if their brain is telling the wrong muscles to hold them in that position, then they're still likely going to feel some of those effects. So For example, you could be in a plank and your brain is still telling your back muscles to activate because it's been trained to do
I was
that.
about to say, it's been doing that for years.
Exactly.
Okay, so what do I do now? What do I do if that's the case? 'Cause I feel like this is just very common, so
Yep.
I want to kind of cover this.
Totally. So what people have to do is activate the correct muscles. And then what I do is I give people what I call muscle memory type exercises. So it's not about strength. We're not trying to strengthen muscles yet. We're trying to activate these important stabilizer muscles. And they have to be able to do that first. So it's about control, not strength. Like handwriting is a great example. I know how to handwrite. I've been doing it since I was little. But if you put a pen in my left hand, I'm right-handed, it doesn't look like I can write.
Yeah,
It looks like I don't know how to write.
that's right.
It's not because I'm not strong. It's not because I don't know how to write. It's because I haven't developed the brain muscle control of my left hand muscles to produce letters and shapes, etc. In the same way, if we haven't developed the appropriate brain muscle connections with these particular stabilizing muscles, glutes, obliques, the deep core, then it's going to be very difficult to engage them during activity. So that's where people have to start, is activating and telling that muscle to activate and practicing that activation.
Do you have any tips or tricks on that? That sounds like a pretty complex thing to do. And
It
something
is.
I hear, like I've been working out for a long time. I've kind of figured out how to do most of these for myself, but I have been in a position where I have tried to explain to someone how to flex a particular muscle and they just cannot do it. Like, you know,
Yeah,
and,
I think
and
it's kind of a tough one to grasp for sure.
yeah. And so, and I do struggle with how to help with that. Do you have any tips or tricks for that one?
Yep. Sometimes it's just as easy as changing the anatomy, changing the position that they're in, and something can click on and they can feel it.
Okay.
You've probably seen that or experienced that. But there's other times, kind of like I'm describing, where they don't have the brain muscle connection. They're telling the muscle signal to go down and it's just not there. And that takes work. That takes work to practice at and work at to build that. So there's no quick, immediate fix in that case. It takes practicing, knowing the right strategies. So a great example is the core, right? We were talking about the core a minute ago.
That's a good one.
And back to a concept you brought up earlier, that there are people that I've seen that like six packs, super buff, strong, but then I put them in certain positions and they can't hold themselves up. And it's not because they don't have strong muscles. It's because they don't have this brain muscle control that we're talking about. So the six pack looks awesome. We all want it, but it's not the most important stabilizing muscle. In fact, it's probably the least important muscle in regards to stabilizing our body and our back. So doing sit-ups doesn't, strengthening the six-pack muscles doesn't necessarily help our back a ton. The most important muscle, in my humble opinion, is the transverse abdominis. The transverse abdominis, like its name implies, goes side to side. The six-pack goes up and down. The transverse abdominis, it's the deepest layer, and it goes, wraps around our midsection. Kind of like, think like a weight belt that powerlifters wear, or a corset. Those are, that's how this muscle is oriented, and that's essentially what this muscle does. And when it tightens and engages, it stabilizes our rib cage, our low back, pelvis, and hips. It's a massively important stabilizing muscle. And a lot of people don't know how to activate it. They don't know what it means to turn this muscle on. And that's a big reason for a lot of low back pain, hip pain.
When the Valsalva maneuver, is that the transverse abdominis?
I was
It is
just
not.
about to ask that.
It's not.
It's not. That's a great question. And this is a big mistake because a lot of people think when, like bracing, for example,
Yes.
say they're doing a heavy squat and they're going to brace,
Yep.
they'll do a Valsalva. And what that is bearing down, right? So
Yes, correct. Yeah, I'm like
Breathing
doing
in
it right
air.
now as we're talking. Yeah, just because I'm
Don't
thinking
do it
about it,
too
I'm
much,
like, yeah. Well, yeah, okay.
I've been doing it since we started talking.
Sounds dangerous. Let's get out of here.
So you don't want to do that. So what you're doing is you're putting an increased pressure inside your body, essentially, in a few different areas, including your brain. So doing that and then adding weight is not ideal. You're not actually activating your stabilizing muscles. In fact, you're probably weakening them a little bit. So I've seen people do that, especially powerlifters and
Yeah, I
lifters.
do that.
breathe in and then bear down real quick. So what should be done is I teach people how to activate this muscle with breathing exercises. So deep breath in, pause at the top, and then deep breath all the way out. And as they breathe out, I describe it kind of like trying to blow up a balloon as big as you can in one breath.
Empty it all the way.
Yes. When we do that, the transverse abdominis muscle squeezes our insides to help expel that air that we're breathing out. So when we do that, we shouldn't see a ton of chest movement. We shouldn't be moving our chest as much. We should see a lot of belly moving. So when we breathe in, the belly will kind of puff out a little bit. And then when we breathe out, the belly will suck and tighten back in. Excuse me. And that's how to activate this transverse abdominis. And that's one of the main exercises I use to help people find this muscle, so to speak. Find how to feel and activate this particular muscle. And that's the movement, that's the activity that needs to be done to provide appropriate stability when, especially weightlifting. So,
well, Sean, we have homework.
Yeah, so breathing out instead of breathing in. I was trying it as you were talking about it. So breathing out rather than breathing in.
That's a great way to simplify it. Instead of the Valsalva, it would be a big breath in and then hold it in. This is breathing in, breathing all the way out and tightening, using the muscle to breathe the air out, and that creates a solid tightening effect.
Wow. Okay, I'm going to be practicing that.
Yeah, I'm definitely going to try that out.
Yeah, I'm going to be practicing that very soon. So, okay, so can you remind me again, I know we kind of went off track a little bit.
Yep.
How do I know that I need stability work? Can you just remind me of that real quick?
Yeah, totally. So people that have identified over their life that they have double joints, perhaps,
that's
they
right.
straighten their elbow and it has a downward angle and a obtuse angle, or their knees bend, hyperextend backwards when locking out their knees.
And so what I need to do in those situations is...
And those are extremes, by the way.
Yeah.
Those are, to paint a picture.
That's right.
People that don't have those things, but they still need stability.
Okay.
So I don't want this to sound like only people that have excessively kind of loose joints need this. Most people need stability. So yeah,
at least at some point, those are extreme examples.
We were just using these extreme examples to kind of paint the picture.
Yeah. So in general, though, and if I have that little bit of a situation, before I work on any stability is basically strengthening that area while it's in a proper position.
Yes.
Am I working on stability when I'm doing that?
Yes, that's exactly right.
Okay.
So you want to be able to essentially lock a particular joint, let's say the low back, in place before you do a movement, deadlift, squat, sprinting, discus throwing, whatever it may be. You want to be able to lock your, in this case, back in place so that when you do this athletic movement, there's minimized stress in through the joints.
And when I'm doing that, I am working on stability.
Exactly.
So it's not like I need to go do 30 minutes of this other thing before I do my workout.
No.
I can definitely get my stability work in within my workout if I'm being conscious about what I'm doing and I'm paying close attention.
Over time, when you practice these concepts, they become automatic. They become subconscious. So you don't have to, at first, like when you're riding a bike, when you first learn to ride a bike, you're really thinking about how to do this movement. You're really putting a lot of conscious effort into how to stay balanced, how to pedal appropriately, how to turn the handlebars. You have to put a lot of conscious effort into it. But over time, it just becomes subconscious, right? It's even a metaphor, it's like riding a bike. That's a metaphor for subconscious activity. So that's how that's what level these things can be brought to. If you practice these things enough and the right way, they become automatic. So when you go into a squat, you just automatically activate your transverse abdominis in a neutral position.
It just happens.
It just happens because you've practiced it.
Yeah, that's definitely something that we discuss a lot with beginners is they have to practice enough. And so I found that like sometimes just using higher rep ranges with a little lighter weights can be really helpful, not only to prevent injury for a beginner, but to give them more practice.
Yep.
Because I always like to remind people that not only do you get stronger, but it's also a skill.
Yep.
So activating these muscles like you're mentioning, getting in the proper positions, that's a skill
Yep.
that comes in time, just like hitting a baseball is a skill.
Exactly.
Right. So it just takes time. Well, let's change gears a little bit. Something that we kind of haven't talked about too much that I really want to make sure we cover is you're so passionate about this thing, but someone apparently at a high level at some point in your past kind of overlooked them. Why does that happen? Why is this overlooked? Why do people not talk about it more often? Why is flexibility talked about and everyone knows they need to stretch more? But what's missing maybe in our, I don't know, in our fitness world, in education, or whatever your thoughts are? Why is this mobility and stability thing seem to be overlooked and more people aren't paying attention to it?
Yep. So I think mobility has really come a long way in the past, especially 10 years, 10, 15, 20 years. It's become significantly more talked about. There's all sorts of social media channels devoted to mobility. So this mobility has absolutely increased in the public eye, you know, in people's minds. It's something now they're starting to see. Little vibration guns, even 5 years ago, were something that only sports chiropractors, sports physical therapists had. Now everybody has a vibration tool, and that's a good thing. You know, those are really useful tools for people to have.
I have a thought of why that is, and I don't know, man, and I'll just share it with you and you let me know your thoughts. I personally think it's because of the explosion of CrossFit. CrossFit uses a lot of Olympic-style lifts that require good mobility.
Yep.
And so I think that just kind of mobility was brought a little bit more to the forefront.
Totally.
That if you want to be successful in CrossFit, then you have to focus on this mobility
Kelly
thing.
Starrett's a great example.
Yes.
You know, he's championed this cause of mobility and even stability. He doesn't talk about it quite like as much as mobility, but yeah, he's a big CrossFit guy, or used to be, and he's definitely one of the guys who's pioneered this topic and becoming, you know, not just something for these elite athletes to kind of talk about, but everybody, all everyday athletes.
Yeah. And do you think that, in your opinion, do you feel like, we need to talk about stability as well, but do you feel like maybe it's only a matter of time before these, and I don't want anyone to take this the wrong way, but, you know, science is ever changing, right? We're ever learning about the human body. And I always like to remind people that there's so many unanswered questions about the human body. I talk to people about nutrition a lot too. So it's very important to remember that there are very few definites when it comes to the human body. There, in general, there's probably more unanswered questions than there are answered questions.
Totally.
So do you think that this is one of those things that people of the past, maybe that went to school a long time ago and they've been around for a long time, they're well respected, maybe this person that whatever situation happened with you years ago, their opinions are respected, like I said, and is it a matter of time before that kind of fades away in this new era of, you know, the way that we adapt and look at things is kind of on its way in? Do you feel that way, or what are your thoughts on that?
Totally. I think that's a great way to depict the scenario. Another sort of factor I think that kind of comes into play is science, for example, research that's done. Research is expensive.
Yes.
It has to be paid for. So sometimes research that could be profitable is preferenced over research that's never going to be profitable. You know, so if you have an academic endeavor that's never going to be profitable, there's probably going to be less research in that particular area. I think this kind of fits in that realm. You know, this is what we're talking about is self-care. You being able to take control of your own body and self. There's no money in that, right? You want the opposite. You want people to come to see you forever.
Or you have to go see them. Yeah.
Yeah. That's so empowering people to take care of themselves is generally thought of as not profitable. So why would we do research in something in that area? And that's not to say there isn't research. There's plenty. But if you look at all the scientific studies that are done on the human body, it's a small amount.
This is a very small amount.
Yeah.
Yeah. But
so I think that's a factor, you know?
I mean, at the end of the day, it seems like things are moving in the right direction.
Totally,
Where
especially
this
with
is,
like mobility.
yeah.
like you
And
said.
so what about stability? And to be honest with you, even when we first met and you started talking about these things, I was somewhat familiar with mobility.
Yep.
But stability, to be honest, was a term that, I mean, I've heard before.
Sure.
But I think about it as like, being stable through a loaded squat, right? That's probably the only time I ever really came across
Yeah.
that terminology.
And that's not wrong. I think it's just it's more detailed than that. And diving into some of these specifics, like we've talked about, can dramatically improve people's injury risk, even their performance, like I was saying before. So stability is definitely something that just is not talked about a whole lot. And it's also not taught very, very well. So when we learned how to move, where do we learn how to do different exercises? In gym class when we were in 3rd grade, right? And we learned how to do jumping jacks, and we learned how to run around the gymnasium, run a mile, and climb the cargo rope or whatever. Those are where we learned how to do a lot of the movements that we do. And then maybe if we did a sport, we start to learn more different things. But stability doesn't enter into that area. Kids are never taught some of these concepts. So that leads to adults that have never been taught some of these concepts.
That's a great point.
So if we're never taught how to do some of these things, then why would anyone know about it?
Yeah, and I'm not your tinfoil hat guy. That's more Daryl. But I'm not very happy about the gym class and physical education situation going on. You remember, Sean, we were talking about this maybe a couple of months ago. You remember we saw that video?
Yeah, there's a video talking about how much the physical fitness test has changed since I think it was like the 70s.
Yeah, I don't remember
something.
the date.
It was kind of a long time ago, but it was just drastically different. Of course, like what they require from kids now compared to back then is just like night and day. You know, they just don't really require them to do that much.
That's
and you can kind of BS and still pass it. There's
pass these kids.
Yeah, there's nothing
Get 'em out of the
really.
next class.
It's probably happening. It's happening in all.
I never thought about that.
Yeah,
Yeah.
Denver was a sub last year a little bit, and we kind of discovered that all the way around. But in physical education, seems to be very extreme. Like the kids aren't
It's not something I've
aren't
looked
being
into, so that makes sense, though.
active, in schools. That's definitely a big thing for me eventually. Like right now we're sitting here, doing a podcast, and I'm not directly like trying to help the education system do better in fitness, but that's something that is on my mind and is on my plate to do because I think this stuff is important.
Yeah.
People need to exercise.
Yep.
This is just so overlooked. And what we're talking about a very specific piece of fitness right now with mobility and stability.
Yep.
But at the end of the day, there is a massive hole and gap with people's education about fitness and exercise.
Yep.
They think that it's okay to not exercise. Guys, this is not okay.
Yeah.
You must exercise. You must move your body on a regular basis. And if you don't, things are going downhill.
Type 2 diabetes used to be known as adult onset diabetes. And now it's not, the amount of children that have type 2 diabetes it's unbelievable, and that's really sad.
Yeah, I agree. This is a completely different conversation that you don't want to see me go on. I think that it's important. But at the end of the day, it sounds like these topics are just, mobility is coming around.
Yes.
In general, though, these are topics that weren't taught at one point in time. But it's looking like we're starting to move in the right direction, which is hopeful for not only adults, but also young people. And I think that we need to teach people so they can then teach kids,
especially
about these
young
things.
people, because if someone learns these concepts when they're young, this is something that they can take with them the rest of their life. And they can really, like I've been talking about, they can really reduce their risk of injuries. There's so many people that I encounter that are older, maybe in their 60s or even 70s, and they're dealing with a myriad of issues and hip replacements or knee replacements. And it's like, man, if someone just told you and taught you how to stretch 30, 40 years ago, you likely could have.
I do this I at least multiple times a month, probably once or more a week, I'm sitting down with someone for the first time. They are whatever age they are. They could be in their, things like this usually start to happen around in the 40s. Typically. It definitely happens when they're older as well. But in the 40s is usually when someone's catching it, quote, early, to be honest, where they're not moving as good as they once were. And they're starting to think about, man, when I retire, I want to be able to do these things.
Play pickleball.
Yeah, go on hikes, like get on a plane and go somewhere. But if someone's retiring at 65 and they've been working their whole life to be able to go on these adventures that they want to do, you got to be physically capable of these things. There's kind of two parts, financial and physical, right? There's two parts to that equation. You got to do both. Right? And so you need to be able to move well. So for sure, we need to educate people. People need to learn about these things. And that's what we're trying to do right here. Obviously, we're focused right here in Houston. Our goal is to help Houston make its way up the ladder of health and fitness. And that's what we're trying to do with the information on the show, is teach people, and they can relay that to our children. And then the children, it's inherent in them. And now 2 or 3 generations from now, fitness and health in general is just an everyday part of life. And that's kind of what we want to get to.
Totally.
So,
love it.
I think that's a good way to close this thing out. Dr. B, do you have anything else to add? Did we miss anything? Is there anything that someone really needs to know about these topics that we kind of brushed over or didn't get to?
We covered a lot. I would just encourage people to continue to educate themselves, kind of dive in and look for different ways to learn about these different concepts. Knowledge is power, right? So the more you can learn about these concepts, I want to give people hope that, big issues, like if a doctor tells us, oh yeah, you have a torn rotator cuff, the first thing our minds go to is, oh my gosh, I'm never going to be able to use my arm again. I'll have to get surgery. These are the thought patterns that we immediately go down with certain conditions like rotator cuff issues or a disc injury, a disc herniation. People think these things are death sentences, and they're just not. If you know how to take care of your body, if you get some of the right expert help, your body heals. Your body absolutely heals. So, like I said, part of my mission is to give people hope that even if they have certain injuries, that their body can heal from them and they can continue to lead very happy and active lifestyles.
Yeah, so. That's the goal. Sean, do you have anything? Questions?
I just had a quick question about, do you have any like stretches or exercises that you suggest for people that probably sit often, very sedentary lifestyle?
Totally. Super good question and super applicable. Tons of people.
To most people, myself included.
So I talked earlier before about the hip flexor getting really tight with being in a seated position for a long time. So the hip flexor stretch is and hip flexor mobility in general is super important for people that sit for a long time. So hip flexor stretch. I would also add the glutes to that as well. So stretching and or rolling into the glutes and hip flexors. Doing those two things for people that sit on a regular basis, they'll immediately feel the difference in their body. They'll immediately feel relief and less tension in their backs, their hips. So,
and can you describe the hip flexor real quick? Where is that at?
Yes, the hip flexor is right in the front part of the hip. Do you want me to describe the stretch? Or
just like where it is and then how to stretch it.
Yeah, so the hip flexor is in the front of the hip. Like I mentioned, it actually anchors in the back, but it attaches into the front part of the hip. So doing the classic runner's lunge, the runner's lunge stretch, that's how you stretch.
2 90-degree angles kind of thing, and then lean forward.
Knee is on the ground, and then lunging forward.
That back leg, the front of the back will feel a stretch as you lean forward.
Yes, exactly. A big... it's easier to demonstrate this than to describe it, but making sure that you're not overarching your back is really important with that. Sometimes people do that. They'll get into that stretch, and they'll really hyper-arch their back because they feel like they can go further into the stretch. But the reason they're able to go further into the stretch is because they're putting slack into the muscle. So you want to make sure your back is flat and straight when you do that stretch, and that maximizes the stretch in the hip flexor.
Hip flexors and glutes, Sean.
All right, there you go.
We're sitting
Flexors and glutes.
All right, well, Dr. B, if someone wants to get hold of you, you mentioned expert help can be helpful. Obviously, you guys can do a lot of this stuff on your own. There's no reason to not be doing these things on a regular basis. If you're exercising regularly, pay attention, work on your stability throughout your exercise, do the mobility stuff if you know that that's something that you need, and just general maintenance. But if someone does want some expert help, maybe they're banged up a little bit, they got themselves hurt. Your office is in Kingwood, right? So do you want to just say kind of how to get a hold of you if you want to, if someone did want to reach out?
Yeah, thank you. On Instagram at Dr. Matthew Brackney. So if anyone wants to find me on Instagram, they can find me there, and they have my my websites and my contact information there. But also my website is fixmysportsinjury.com. So if anyone wants to check
How much was that? Did you pay for that?
Yeah, it was a long time ago.
Oh, did you get a good deal on it? That sounds expensive. 'Cause digital real estate is a thing.
Sure,
That's
totally.
a really cool domain.
Yes.
Yeah.
Thank you.
Yeah, I like that a lot.
Yeah, I can't take credit for it. It was my predecessors, my mentors that
purchased
did the
that?
work- that purchased
I
that. So,
bet it was
Nice,
expensive.
nice.
yeah, I'm
Yeah,
not sure how much. I never asked them.
Oh,
I should ask
cool.
them.
I'm interested. All right, cool. Well, guys, for sure, check out Dr. B. If you on Instagram, all his information there. Fixmysportsinjury.com. Great URL there, so make sure you check that out. And we will see you guys next time. We're out of here.
Peace out, guys.
Later. Like, subscribe, share.